But think about it. A pap smear, they're literally scraping cells from your cervix, right? And you go home and, you know, if they're putting in like an IUD, there's no pain meds that you're given to prepare you for it.
None.
But a man will go in and get a vasectomy for 15 minutes and gets morphine. Jerry is visibly offended.
I'm tired. I'm upset. Tufunge, in fact, end the episode. Let's go fight for our rights.
Welcome back to another episode of Maju Diaries. My name is Warimo.
And my name is Jerry. Karibuni sana Maju mates. And for those who are new, hey, Karibu. This is Maju Diaries, where we do life Maju, especially here in the US, because that is where we are.
Yep.
And we are Kenyans, and we are so excited that you have come back to watch another episode. And just for a quick second, I just want to shout out the real ones for
the
real ones for just sticking with us as we navigate our sound. Tumepata mics mpya, tumepata budget mpya, so new money, we don't know how to act. No, but thank you. We're figuring it out. I'm hoping this episode, our sound is great. You can hear us nicely. But anyway, let us jump into what we have in store for you today. As you see, tuko na mgeni hapa. Amevaa pink kama sisi. If you want to be on Maju Diaries, you have to follow the color scheme.
Yep.
And yes, this is Dr. Wangechi. We have her in today for this episode where we're talking about health within the Black community / Kenyan community, because you know there's that stigma of people separating themselves as African Americans and Kenyans, but at the end of the day, we're all Black. Sindio?
Yep.
Hiya, Dr. Wangechi, please introduce yourself and make them smile.
If it's not the pressure for me. Anyway, my name is Dr. Wangechi. I am a born Kenyan, right?
Yeah.
Duh.
Are you confused? Umeka America sana.
Kenyan born and raised. Came to America in 2020. I decided, Kenya, let's go see what Maju has. Since, Njeri was here and she was giving off a life that was very snap. Hey.
Alikuwa
anatesa. Hey. Only now we've heard from Maju Diaries, well, like the struggle she was going through.
Ukweli isemwe.
Angetupatia warning, angalao, disclaimer.
It's life.
Yes.
But I was a general practitioner back in Nairobi, Kenya, and then I decided to transition to America. And the journey has been dot. Yeah, but we are glad to be here to share more about health in Black people, and yeah.
Awesome. Miss Warimo.
Yes.
Situanzia maswali tafadhali.
I want to know, before, let's get some more to get to know Dr. Wangechi a little bit. So you are a general practitioner, which is what they call CEO, or what do they call?
Medical officer.
Medical officer, yeah, that's that one.
Yes.
So when you moved to America, were you coming to be also a medical officer? How was that transition like? Like, did they just take your papers and be like, let's go continue like we never stopped, or how was it like?
Unfortunately, America is a very tough country to enter into the medical field. They like things their own way, right?
Yeah.
You guys, we drive on the other side than any other country. I know. Everything is just very different, and so entering medicine as an outsider, they really don't accept you easily. So you have to do a lot of tests then you also have to practice under a medical doctor for you to be able to get a letter of recommendation to say, okay, I've seen how she's practiced, I see what she's doing, and yeah, we accept her into our leash.
So all your years of experience in Kenya, like
Null and void.
nobody cares.
Nobody cares. You pass their tests, and then you pass their social tests, and then yeah.
Oh my
They don't have
God.
MOs, unfortunately, here.
Yeah.
So most of the students here transition straight into residency before they are able to practice on their own. I practiced on my own for a bit.
Okay.
Yeah.
Well, as Jerry said, today we want to talk about some of the challenges or kind of like the state of health in the Black community, and as she said, it's both African Americans and Kenyans and all that stuff. So from your point of view, what would you say is like one of the biggest, what's that word? Biggest disparities. Sijui nisoma swali vile imeandikwa.
Let me give a disclaimer. When Jerry sent me the questions, I was taken back to medical school, ethics
welcome.
class.
Yes.
10 marks, please.
Yes, we want quality content.
Yeah.
We want things
We are
to
growing. We gotta, even our English has to grow.
Yes, you can
What are some
understand.
of the health disparities that we've
Disparities.
seen in the Black community?
I think the major one that we have to talk about mostly is maternal and infant health.
Talk about it.
Because if you've been a woman, and especially been a woman here in America, I personally seek out a Black female OBGYN.
Okay.
Just because I want someone who has experienced motherhood, womanhood in the color of the skin that I'm in. Just because here there's so much systemic racism when it comes to do Black people experience pain in the
Yeah.
same way as white people?
It's wild that that's even a
I
thing.
know.
It is,
Like we both
Yeah.
bleed, but sure.
but the pain, and studies have come out where before in the 70s and 80s they were like, Black women don't experience pain the same way as white women do. Or you go to the doctor and you say, I'm experiencing pain as a Black person, but the white person goes in and says the same pain and they're given higher pain meds than you because you're tough.
You're
Yeah.
tough,
strong,
you're
Black,
You're strong.
independent.
You know?
that thing annoys the living day out of me.
And it's so sad that, you know, a lot of the maternal issues that come out is because Black women are not heard effectively to be like, I'm in pain, help me now. And so they struggle with navigating that. So one of the main issues is maternal and infant health care that I would
I
say.
like that point. They're not heard. They're not believed. That's why a Black girl will disappear and nobody cares. But when a white girl disappears, it's
Major news.
Trendy.
Yeah.
You know, that is so wild because when I was having my son, like, there's a lot of things I didn't. One, I don't have a Black OBGYN. I was just referred to someone who, she's Asian, I think. She's Asian. She's pretty good, but of course, I mean, I've never really experienced the difference between a Black doctor versus my doctor, like if there's any difference in how they offer care. But I've heard, you know, they you know, someone from your race might give you more care concern than a different race, right? But if my husband wasn't with me during the process, because and what I've learned, and I talk about this a lot, it's about you either advocate for yourself or have an advocate. So like when I'm out, my epidural has kicked me out and they're trying to do something, my husband's like, what are you doing? Can you tell me exactly what you're doing? Like, you gotta have an advocate there, really finding out what's being done, advocating for you. Like, I think even there's a point he had to tell them to change my whatever, TMI, my pee bag, you know?
Yeah.
Because, you know, I don't know, it's just so unfortunate that that's something that we have to deal with, that someone is saying that they're in pain, but they're not being believed because of their race.
Yeah.
Oh my God.
Gosh.
Yeah.
Yeah, I think actually now that you mentioned that, my gyna is actually Black. Or rather, let me say the last one I saw was a Black woman because I've seen a few. But for sure, she made me feel more at ease because when we were doing the, what is that yearly test? Papsmeres. She literally walked me through the whole process. Kuna wengine anasema, okay, open your legs. I'm like, okay, at least buy me dinner.
But can we also discuss that as a woman, a pap smear is very painful.
It is.
It's very.
Is it?
It's very painful.
What do you
And
mean?
women.
I don't feel any pain.
Maybe because you've given birth.
Maybe.
I don't know.
Me, I felt pain.
Really?
And me, I'm a doctor. And me, I felt pain.
Is it just me? Are they not doing it right?
No, like I said, maybe
It's uncomfortable.
Yeah.
There's
They say it's
pressure.
uncomfortable, but yeah.
But think about it. A pap smear, they're literally scraping cells from your cervix, right? And you go home, and if they're putting in like an IUD, there's no pain meds that you're given to prepare you for it.
None.
But a man will go in and get a vasectomy for 15 minutes and gets morphine. Jerry is visibly offended.
I'm tired. I'm upset. Tufunge, in fact, end the episode. Let's go fight for our rights.
We got this. We are strong, independent black women. We got this.
Oh gosh.
Wow, I never thought. I mean, oh wow. Okay.
It's just
It's uncomfortable.
I
think I've had my water has been broken when I'm wide awake. So
first of all, as someone who's done that, I am. Wow, you're very strong.
Wait, now I feel like we're going down a hard left, but allow us, please stay here. What do you mean they burst your water?
Yeah.
So
when my son was induced, so at some point they have to, because if your water doesn't
progress
break
quickly and your water doesn't break, because when water breaks, it releases prostaglandins. That's something else. It releases like chemicals to help your cervix open up more.
Okay.
So if it's not popping, then I as a doctor have to go and manually create a cut and pop it so that the fluid.
I'm glad you said that, because I was wondering, do you go in with like a pin and just?
It actually looks it.
Yeah, it is kind of like a hook.
It looks like a hook.
It's a hook.
Yeah. Man, but let me say,
that's a crochet hook that
Yes.
you think of it like that. Like the mokoha for.
Yeah.
Yeah.
And then you are awake when they were doing that?
I was, but that time you haven't been put on
to
any
be.
epidural. You have to
be awake.
I mean, we can't
It's
do it
uncomfortable for a second, but then I feel like by that time.
You've had so many examinations.
Exactly. Because when they are checking your cervix, when they're checking
like
how
we've gone
much you've dilated, we've gone to
maternal health.
Rewind, guys, my roommates.
I don't want to scare you, Jerry. I don't want to scare you. Let's go back. We're talking about maternal and infant health.
Yes.
So even the babies are not believed.
Yes.
Wait.
Honestly, for real, some children do say that, as a black kid, I go to the nurse and I'm having a headache, and it's not taken as seriously as when my goes in.
It's okay, you can say white. You can say white. You can say white.
It's not things we are pulling out of our behinds. It's something that actually happened. So it's the truth.
That's
so we
true.
Can talk about it.
So they're not believed as frequently as it's as severe as, and that's why you have if you've not noticed, the past maybe 2 years, there are kids who've died in school because of an asthmatic attack that wasn't taken seriously. As a black kid, and they're just like, just go and get some air, and you're like,
and then that air kills them.
I mean, they can't breathe, so
they can't breathe.
So
Jesus.
All I say, especially as a black woman, a black mom, always advocate for your child no matter what. Even if sometimes they're faking, but most of the time, if it's a persistent complaint,
advocate, make sure you get something done.
And just the way you
about
said it, advocacy, especially with black people and black people, I will always champion for advocacy.
Yeah, and insist.
Yes.
Because
don't go to the hospital by yourself. Go with someone.
Yeah.
Because if something happens, what do you do? Yeah.
It's unfortunate that we have to get there, but advocate for yourself, advocate for your people, speak up, insist,
Yeah.
Insist on, I still remember till today, my son has something on his face which started growing at around 4 months. His pediatrician, when we first saw it, he really downplayed it.
Yeah.
And he was like, I will be gone in a few months, And by the time, so of course we believed him because it's our first child. He's a doctor. We don't know anything better, it will go soon. When I tell you, when we finally at 6 months, was it at 6 months? 6 months when we took him now, we just decided, you know what? Let's actually see a pediatric dermatologist. And he was like, why did you not bring him as soon as you came? Because then we would have of course, it doesn't go away like 100%,
Yeah.
but the chances of it like really shrinking down and going away, it would have been so much if you brought him as soon as it started. I was like, we just believed our pediatrician. We just believed what he told us.
Aibo.
From that day, if I see my son within him, let's go. Let us go. We have HSA, let's go. Let's go take him.
And another thing that, I mean, you brought it up, health savings accounts. Because, you know, with black people, healthcare is
We've talked about it.
crazy expensive in the Mayus.
Usiingie ambulance.
Me, I'll even tell you a personal story that happened, last year in March. You know, I woke up, I was in pain. Just those ones you think you're cramping, but then you're like, you're strong.
Yeah.
You know, we've cramped how many years?
Yeah.
And and I was like maybe 3 a.m. and I woke up and I couldn't pee. So I was like, okay, maybe it's just, you know, something is off. But you know, you're strong. I took my brother to school, I went to work, but every time I stood up, you know, it was just like, something's
is
not
off.
right.
Yeah.
And then my stomach was gradually getting bigger and bigger. And I'm a big girl, but you know, there's a way your stomach is getting bigger and bigger. And you're like, this is not my size. You know?
Yeah.
And so I took myself to the ER. I took myself to urgent care actually first. And urgent care was like, you sounds like appendicitis, go to the ER just in case you have to have surgery. And I got there and I'm telling the lady, like, I am in so much pain. Walking from my car to the reception was so painful.
Yeah.
And she's like, have a seat, we'll come and get you when we get you. And I was just like, I've been in this, and this was like maybe 8 hours later, it was like 11. And I was just crying in the lobby, just waiting for someone to come get me. And even when I saw the doctor, it wasn't like they were taking me seriously.
Yeah.
And then I got a $17,000 bill.
Not $17,000.
$17,000.
And you didn't.
And I
get
had
the
insurance. I drove myself in pain, you know, very slowly. And you know, in Texas, they hoot at you if you're not going 80. And they gave me fluids. They gave me paracetamol first, and I was like, I've taken enough paracetamol for me to know this is not working.
Yeah.
So they gave me something else. I think it was like an NSAID, like a diclofenac. And then they did a CT scan, which just showed like I had like cysts in the ovaries and they were very big.
Yeah.
But then the doctor was like, okay, you go home. If they burst, come back.
If they burst.
If they burst, come back. If you're in more pain, come back. And at this point, I'm like, okay, I need to call someone because me, I'm in pain. So I called my brother who came, sat with me. At this point, I'm still crying because I'm just like, and me as a doctor, I know because we don't like even as we don't like it. But when it's bad, it's bad.
Yeah.
But what made it worse was the bill that came after.
Wow.
$17,000.
So they did it. Okay, sorry. Me, I don't know these things. When they saw the cyst and they tell you if it bursts,
So you know, there's a criteria
Okay.
of which you're operable and one they call watchful waiting.
Okay.
So mine fell under watchful waiting,
Gotcha.
right?
That's why they said
Yeah,
Go
we wait
home,
here in the
yeah.
hospital. We wait here.
But I think it got worse when I saw the bill after, because I was just like, it was a deductible plan, so you pay a set amount at the ER and you get seen. And my insurance had told me this is the one ER to go to, and I went to that ER.
Yeah.
But apparently, the doctor who saw me was not covered by my insurance.
But it's that CT scan though. That CT scan because
No, the CT scan was covered.
It was covered?
100%.
I did
It
a
is
CT
the
scan
doctor.
once. I got a bill for $10,000 too. CT scans are no joke.
Kenyans.
Eh?
I know you guys don't have many, but yeah,
But
here they charge
still.
you an arm, leg, and a kidney.
Oh Lord Jesus. have
Hey!
mercy.
Yeah, but again, the advocacy that she was talking about,
Yeah.
I literally told my insurance, bill it again and send me an itemized bill.
Yeah.
And that came down from 17, it went down to 12, and then I was like, run it again. Right now, we're battling 1,700 from 17,000.
What?
It is possible because sorry to really segue again. I've worked a little bit in insurance. I was working in doctor's office, so I dealt with running insurance a little bit, not too much. But I'm telling you, they will bill the insurance for as much as they can,
Yeah.
and whatever the insurance doesn't pay, they give it
bill
to
you.
you to pay. Me, I'm like, I paid my deductible.
Yeah.
I'm not paying you this much because this is how much you're trying to get as much as you can from the insurance.
Wow.
If they don't pay you, I'm not insurance. I don't have insurance money.
Yeah,
I'm not an insurance company. So no, don't send me insurance bill.
Wait, remote health insurance company.
I'm not.
You should start one for Kenyans.
I would
Wow.
go down south. No. If I'm like, you've already billed the insurance and the insurance has already paid you
Yeah.
as much as they can. So you want now the rest that they didn't pay to come to,
on
me?
me.
No.
And that's why I advocate for health savings account. One, it's tax free.
Okay.
So, you're able to take it from your paycheck tax free
Yeah.
and use it without it being taxed. So if you
Yeah.
can get a HSA,
Yeah.
that's just my secret.
Yeah. Absolutely.
Hey,
Turudi kwa
Guys.
maswali. Yeah, segue.
Segues.
we've gone around the world. Not even the world. We've gone to different planets. Like, now, sasa wacha turudi planet Earth.
Yes.
Hey, are you still with us? Okay. Now, what was question number 2?
Oh, we haven't even talked about one health disparity though.
Oh, okay. There's more.
As Black people, we also have to acknowledge the fact that one, we are at a higher risk for obesity, which then gives a risk to heart disease and diabetes. So, one,
Okay.
what are we eating as Black people?
Wait, pause. I have a question.
I don't know.
Why do we have a higher rate to be obese?
Just genetics wise, we store fats in a way that white people don't.
That is why. Okay.
Yeah, our hips, please, were not made to lie.
By the
Okay.
way, you are right. Oh, it's not making sense
Small hip
now.
stop. yeah.
Same was that. So yeah,
wow,
genetics play a big thing. Social, cultural, like economics wise.
Yeah.
More Black people live in food deserts, and that means like the grocery store that is closest to you is how far from here?
Yeah.
Which one is closer, McDonald's or a HEB,
And McDonald's for sure.
right?
Yeah.
But if you go to a very white neighborhood, which one will be closer?
Whole Foods.
There you go. Right?
Yeah. And there's also like McDonald's is way cheaper than a bag of groceries.
Exactly. So you as a working mom coming from work and your kid is like, what are we having for dinner? Let me just stop by some nuggets and some fries, and then we go.
$5 and you're good to go.
Yeah. And what does that do? Just makes you obese, and then you're at a higher risk for. I know Black people are 2 times at a higher risk for diabetes and hypertension. And hypertension leads to other complications. You'll get a stroke. You'll get,
Kwanzaa diabetes.
it's
yeah.
a cascade.
So we need to learn how to, for people, say for example, the people that live in food deserts, stuff like that, like their situation is already not good for them. How can they work to, I guess, a better health for themselves?
Unfortunately, that gets out of the scope of as an individual and more of like what your community can do.
Okay.
Right? Because at this point, your councilwoman, your governor, your senator has to give you a local community store to go buy your groceries.
Right.
Right?
Okay.
They have to give you a space where you can go get an apple instead of getting McDonald's or
Fries and
Chick-fil-A,
nuggets, yeah.
right? And also providing nutritious foods for kids in schools,
That's right.
right?
Yeah. God, the
It-
things
it's
they eat in school.
Choker.
There's so much that
Wow.
as an individual, it is outside your scope,
Yeah.
right?
Yeah.
You live in a food desert because that's what you can afford.
Yeah.
Because as Black people, we know we're not at a socio-economic place compared to our white counterparts, right?
Correct.
So lobby, and that's advocate for you guys to have. It might not be a Whole Foods, but it can be a Walmart,
Yeah. Walmart is great.
and they have good
Wallow,
food.
wallow.
Please, me, I'm a Walmart girly.
I know, me too. All right, you be. But that's oh my goodness. So very good to know. Like you're more predisposed to have diabetes and obesity, so it's you need to take your health very seriously.
Yeah.
And
If you
just,
can.
just to add on that, I'll touch on this briefly, literally in this sentence, because you said if you live in a food desert, sorry, it's really like external factors that are controlling the situation about groceries. Black people don't vote, and I'll leave it at that. We'll
2024 is a
hopefully,
voting year.
yes, we'll hopefully get a congresswoman, politician. I don't know. We might find somebody who can talk to
I
us
know.
another episode, because we really need to be educated about voting, because I have very close people who don't vote because they don't
Yeah.
believe in the power of voting, and
They don't
we
believe
see.
anything is gonna get done.
Exactly.
I wish, you know what I wish America had, especially in those places?
Yeah.
Mama Mboga. Like those two kiosks on the side
You
where
know,
you
I
can
miss
just...
them.
I know.
You go down and they kata for you
I
skuma.
know. Oh my God.
They kata for you for 20 bob.
Ah.
And you make a whole nutritious meal.
I know.
Have you ever realized that if you go back home for holiday, you lose weight,
But you eat more.
but you eat more?
Absolutely. Absolutely. You're eating
No, me, I
clean,
gained.
healthy.
I'll just say that I gained.
No, and
But
also
you
the
gain because those
walking.
are good nutrients.
Yeah.
Yeah,
Right?
good nutrients.
Those are good nutrients you're gaining, and so your body was like, wow, we are back.
I know.
We are
But
back.
I always make this joke there. My father says this is from Nesha to you. Nesha to you.
Nisha, natural. Oh, natural.
Natural.
Yeah. That
Wow.
is hilarious. I see. What was the other? Yes, let's talk about early detection.
Okay.
How can early detection and prevention strategies be tailored to address the specific, health needs for the Black community?
Very good question, guys.
Mm.
10 marks.
Uh-huh.
Early detection is what? Getting screening, being aware of where you are and what is available to you.
Yeah.
Many, let's just be honest. When was the last time
Mm-hmm.
you guys went and got a health annual physical done?
What? I don't think I've done it since I've come to America.
Really?
I've done PAP.
I'm not talking about women health.
I've only done women health, honestly.
I did.
Mimi ni vibes
But
na
the funny
Mungu.
thing is, I've done I think like 3, but the last one I did because I changed doctors. It was so
Okay.
weird because I went in. I was trying to change and get an actual PCP, like a real PCP that I can be going to, but they did all the blood work. They did everything. Nobody ever called me. You know how like you go back to discuss your results?
Yeah.
Nobody ever called me. They sent me
Yeah.
the results, so I'm just reading them myself. I'm like, okay,
What does
try
this
TP.
mean?
I go, what? I'm like, I'm trying to Google what does this mean. Nobody ever told me anything.
Oh, wow.
Yeah. And it's so sad because my, again, TMI, my thyroid is hyperactive and I know it needs to be treated.
Yeah.
But thankfully, my OBGYN caught it and now we're treating it with my OB.
Yeah.
But it's like,
Then what is the role of the PCP?
I know.
Okay. First of all, please,
Yes.
please let's go get an annual done.
Okay.
With your insurance, it's free, my dear.
Yeah, with your insurance, please.
So wait,
If
what?
you have health insurance, it covers one annual physical
Yeah.
every year and one woman health appointment every
And
year.
also a full body skin exam with a dermatologist.
Yes.
What?
Mm-hmm.
I've never tangu niingie hii America. I just go when I'm sick, and also because the women health, that one I know is very important. But
Yes.
annuals.
Please.
So I enter. I say here I'm here for
I'm
an
here for
annual.
schedule an annual. Essentially, what happens in an annual physical is, you do an examination. They listen to your heart and lungs. They look in your ears. They look in your eyes.
Okay.
They check you. They're supposed to palpate and shika and make sure you don't have any. Saskia. Make sure you don't have any lumps or anything that should be. Examine your breast for women. Examine the scrotum for men. If you need, they take some blood. In the blood work every year, you should check if your sugars are fine. That way you're able to see if you have any diabetes.
Yeah.
They check your
Yeah.
blood pressure, make sure you're not hypertensive. They check your thyroid, make sure you don't have any thyroid issues, of which Black people, please check your thyroid. And your vitamin D level.
Oh, yeah, and that one too. That mine is.
Yeah. Black people,
Mine actually is.
unfortunately, as a segue, our skin doesn't absorb the vitamin D properly from
Yeah.
the sun.
Yeah. Why?
We're dark skin, we have too
Dark
much
skin.
melanin, right?
Okay.
And therefore,
That's
if you're
why
not,
we don't get burnt.
Burnt.
we do get burnt,
Okay, but
not as severe
Sunburnt
as our
like them.
white
Yeah.
counterparts. Yeah. So you can add on a vitamin D level if your insurance covers it. Please make sure your insurance covers it.
Kwanza, if you work indoors and you're
Yeah.
not an outdoors person.
They also check your cholesterol.
sijui tuandike list kwa nini
Comment section.
comment section things to No, for real, because
Yeah.
I'm hearing these things. I'm sure my insurance covers it.
Yeah.
Every
Na
year.
sijaitumia.
And you know it doesn't carry on at yours because you didn't do for the past 4
Yeah.
years. You have 4 free visits.
No.
Once it's over, it's over.
Yeah. This is a really important point to say. If you're there and you're like Njeri, you have not done an annual physical.
Vibes
please.
na Mungu.
Hey, uta vibes na Mungu pia mahali kwingine. But even in Kenya, there are annual physicals being done. Many people just don't know about it.
I'm sure.
And in Kenya, people don't go to the doctor. Actually, not just in Kenya. Black people are calling to you guys. Because even me, I'm a victim of it. We don't like going to the doctor. Why? Because we already have that stigma that no one will believe me. No one will. I have a homa. Oh, it's just allergies. And that time you're dying of COVID.
And I feel like some people, so there's this notion that when you go to the doctor, they find things.
Yes, that's me. In fact, maybe that's why I've never gone. They look at me, they say, oh.
But why are they finding things? Because you've never been checked before. And so nothing could have been stopped in stopping the progression of a disease because you've never had a screening done. If you came today and we find that your sugars were elevated and I tell you, hey, stop eating those donuts. I know you love donuts.
Yeah.
How about instead of 4, we eat 1, right? That will slow the progression for you to become a diabetic,
Yeah.
but you're still
Early
enjoying what you
prevention.
like,
Early
right?
prevention.
Yeah.
Hey, today we are being shouted at.
Can you
The
hear me?
shouting is real.
Mic
No,
check, mic
for
check.
real. Now that I hear you guys saying it, and I had a discussion with my therapist about this briefly. She said how Black people in general prioritize health in such a not negative way, but in such a low. They hold it so lowly because think about it. Me, I've never gone for this annual, and it's free. It's free. I can go. I just schedule. Gari yangu, if it's Nini's on the highway, see, I'm calling AAA. See, I'm taking it to the mechanic. See, I'm telling him, can you fix everything? I don't even want to see any problem. And I will pay inside. I'll complain here and there, but I will pay. But me, myself, something I can go for free. Guys, I think we need to do better.
We need to do better.
We need to do
Yeah.
better. A car is replaceable. Sasa, the body God gave you, it's only one.
Yeah.
I know there's plastic surgery, but we're not talking about that.
But also, and yeah, that's really good that you mentioned that. But I also wanted to touch, because we've talked about people who have insurance, and there's a large group of people that don't have insurance with their jobs or whatever. Maybe are you aware of like how people can still get this service without insurance and how expensive it is, you know?
So there are different ways we can address that. One, if you're not making enough, you can apply for Medicaid,
That's right.
right? And there's also Medicare for people if you have like long-term health diseases, you can qualify either Medicaid or Medicare.
Even when you're not over 65? Oh, wow. Okay.
And let me tell you, insurance, they won't tell you everything because they also don't want many people to get onto that program and then utilize too much of the government funds. Corruption is everywhere. But there's also community care centers that offer you subsidized healthcare. I think in Texas, it's called community care.
Okay.
And then there are also doctors that offer cash to health services.
Yes.
Where you pay a subscription fee, I think ranges $75 a month, and I think you have to sign just a contract for like a year, where you pay them just like your phone bill, you know, and you can go see them for an annual physical, and they do your lab work and whatnot. And especially for like where I work, and I won't name them because we don't do free advertising. We do have subsidized for people who can't pay, who don't have insurance.
Okay.
While it is a private practice, so it does take more. If you honestly Google like low income healthcare services, so many resources come in.
Okay.
So many resources come in.
And I
so
feel like
Google
that's
for your
something-
state and your town as well, because it varies. My county has more than my neighboring county in terms of how much funding they get from the government.
It's another thing.
Yeah.
Man. But yeah, I think it's something that you can save up to be able to get because it's an essential service. It's not like, I mean, our nails are always done. I think we can spend some of that money and get our health checked.
Yeah. And I believe health is I mean, it's physical, it's mental, it's spiritual. You can't say you're healthy if you as a person from the inside out is healthy, right?
That's right.
So physical health is still a part of it. It's not just, oh, new year, new me, or sijui, what do they say?
No, neither they give Kenyans give this excuse. We'll be given new bodies in heaven.
Is it not true? Where is the lie? Where, no,
Given new
tell me, where
bodies.
is the lie?
No, what you want to be fat in heaven?
Bus.
The issue is, before you get to that heaven, utakuwa struggle. You'll be living a very difficult life with pills every day, doctors every day.
Yeah.
You don't
Your
want to
body
be
is the
miserable
temple,
towards
guys.
the end.
Body is a
Yes.
temple.
So.
Yes.
And you've also been given a mandate by God to take care of it.
Absolutely.
You've been given a
Absolutely.
mandate to take care of it, so do something about it.
Next question.
Dr. Wangechi, tuambie, as a doctor, how can you create a healthy, welcoming environment for our fellow, I was going to say attendees, patients, black,
Yeah.
white, but mostly our black counterparts. Is that the right word to say?
Yeah.
Okay,
Yeah.
just making sure. We've been using big words this episode.
Disparities.
You got it.
I think one of the things as doctors we have to be very aware of is how culture affects patient care,
Okay.
right? So as black people, we are very loud. We occupy space, right? Someone can come into the hospital and, they're loud and vibrant and they're wearing rings and they have long nails and then you think, there's always, and they say the first 5 seconds you meet someone gives you kind of an idea of who they are. I just think there's a very systemic racism in medicine, and where, especially in America, black people are taken as hostile whenever they come to the doctor, right? Just because they're more vocal about saying, actually, I don't like that. Can we discuss something else? Or can we tailor it back to what I came here for?
Yeah.
And people have said that, I wasn't listened to. I wasn't, because the doctor now assumes that I'm being hostile. You've had people go to the ER and then they're chased away because they were loud, because they've been waiting for hours and now it's taken as a security issue, right? So I think as doctors, we need to educate ourselves about culture and how that relates to healthcare, right? Just because I'm loud doesn't mean I'm hostile. Just because I'm speaking a different language doesn't mean I'm talking about you. Doesn't mean I'm being weird or whatever. Listen, as doctors we need to listen more than talk more. And I think that is where we're going wrong, because we've studied, we know all the right things or how to diagnose, but we don't have social awareness as doctors.
That's the part right there.
Can I ask, did you have the same, okay, maybe not the same type of issue, but what type of issue with your patients did you have back home in Kenya?
Yeah.
I think there was mostly ignorance in terms of they weren't sure, they didn't know what they wanted, You come in...
The patients.
Or you come in thinking, I've come in for, like, let's say a stomachache, right? And I've done the test and I've found the cause of your stomachache. But you want anti-malarials because you believe the stomachache is being caused by malaria.
Okay.
So I've gone to the doctor to tell them what the problem is.
Exactly. And that's because you've consulted with your neighbor and your mother and your cousin and your long lost...
Na Mungu alikwambia kwa ndoto. Wow.
Not everything is malaria.
Yeah.
By the way.
Not everything is malaria. Not everything is typhoid.
Yeah.
And not everything is treated with an antibiotic.
Oh my goodness. If there's something
Kenya,
Kenyans believe in is antibiotics.
That homa you have is not a bacterial infection. It will go away on its own. You don't have to take dawas for it.
I have a question. Wow, and I hope this does not throw you off, but there's a little bit of I have an auntie of mine who is also a doctor, and there's a little bit of a perceived notion that doctors are not very empathetic. or rather when you tell them like this is how I feel, they don't really like empathize with you. They just go straight to, like, they don't panic with you. Sometimes patients come in and it's like panic, and they're expecting empathy. Is it a bad thing, or is it something that you're taught like to keep it level-headed despite what the patient comes in saying or doing? You just keep it here and not like try to go up here emotionally with them, and you just keep it kind of level-headed to where it might look like you're not being empathetic.
And to add on to that, is it also a possibility that they've been desensitized by all the patients
Everything
they've seen?
From my own experience, it is more of desensitization. I go in, I do my rounds, I see a patient who was well yesterday, I come back and they're no longer with us. That breaks you down. But you have no time to internalize and process that. We see so much death. We see so much. I want to help you, but I with the knowledge that I have, we've come to an end. And I don't know how to, if I put empathy, then I break down as well. And what happens to the next patient who comes into the room after you?
They'll need your strength.
Exactly. And it's not the fact that I don't want to be empathetic. We very much are, but we also have to protect the semblance of, I need to go home and still be a sister, a wife, a daughter.
Right.
You know, I still have to, let me put it like this. Doctors are very good at categorizing. Categorizing their life, categorizing their home, categorizing their friends. Those two.
I said that last week. Literally, Lucas said the exact same thing.
We are very good at, and not anyone in healthcare actually. Nurses will do the same thing too. We're very good at categorizing our lives. And when those two clash, many doctors burn out.
Hey, okay, so now you've brought it up, like kijuju, mental health in the doctor world. Is that something we can talk about now? Maybe episode ingine. Just,
I personally am a mental health advocate.
Yes.
I advocate for everyone to, one, go to therapy. Two, please do not die alone. There's always someone somewhere who will help you no matter what. But the burnout in medicine is terrible. Just because as doctors, going through med school, going through residency, going through just the practice, we don't have the support or the structure for you to go and complain to your supervisor that, oh, I'm struggling. One, now they look at you're weak.
A weakness.
Right? Now it's a weakness that they can use against you. And then you can't go home and complain to your spouse because there's HIPAA. You can't go complain to someone else because how will they understand that yesterday I was joking with this patient and today I come back and
they're not there.
You know?
It's a sad world.
Because like a friend of mine mentioned, you as, I'll call you common folk. I'm sorry.
the commoners.
No, as regular humans, you guys experience death once every few years. A doctor experiences at least one death a day.
Haibo, that's heavy.
So, I want to be empathetic, but I also have to remember the back of my mind. I have to go process the person I lost this morning and be aware I might lose someone else throughout that day.
Yeah, if I was given that burden to bear, I couldn't. So thank you for all you do. Honestly.
You're welcome. But as doctors, please seek a therapist. It's okay to not be okay. Talk about it. I offer support, like the groups for doctors back in Kenya and here. Talk about it. Don't die alone. The risk of suicide amongst doctors is very high. And that's the worst part.
I can only imagine. Kwanza when you know this person was in my care. And then now they're just gone like,
No, as doctors killing themselves.
Yeah, no, I'm saying someone like that. So that person was in my care and now they're gone. Now I'm kind of quote unquote blaming myself. That would drive anybody to do something like that. I mean, unfortunately. So, and I understand why you really have to detach yourself from like being too emotionally invested in people because they could go. And then you're the one who's stuck with all the emotions. I think what I'm learning here is we really need to be so empathetic to the doctors because I'm one case out of the many they see in a day.
Yeah.
So they're seeing a lot of different characteristics, different personalities, different diseases. They're seeing a lot. And so we can also be a little bit empathetic towards them and understand that they're also going through a lot.
Yeah.
Yeah.
But also the doctors can also be more compassionate and
We're
create
going
a
to
healthy
try.
environment for us to feel like, oh,
But
the
raise it
hospital
up,
is a welcoming
raise it up
place.
as well with your doctor, though. If you
Yeah.
feel like they're not connecting with you, raise it up. I don't
Yeah.
think a doctor will be like, "Why are they telling me I'm not personable?" We also don't go through classes of how to
Personality.
be personable.
Has to be
You know,
personable,
we
yeah.
are more focused on let's pass this test. Let's,
Yeah.
you know.
Yeah.
So a personality class was not. I wish they could put it.
It was not
but
so fun.
but honestly, they're very people. Like a lot of my colleagues back home have burnt out in the fact that they go practice. They're book smart, but they're not street smart. You know, how do you now sit down with a patient and actually talk to them and figure out what's going on?
Right.
You know,
Right.
how do you churn out the information from them instead
Yeah.
of just listing it? Okay, shida yako ni gani? Okay,
Yeah.
Yeah, I can help. Me, no street smart. This is episode 1 I told you guys. I'm street smart. I can be the interpreter. Okay, sasa.
Ulisema ulikuja na?
You
know.
Doctor, this is it.
Oh
Yeah.
my goodness.
But if you're in
That can
Kenya,
be a
also
job
be
you can
patient.
create.
Yeah. Triage for us, please. Be our social interpreter.
I know.
Hey, we look into it. Tutaniona hapa. Anyway, Dr. Wangechi, thank you so much. Do you have any parting shots, anything we haven't discussed and you feel like, hii lazima niseme kabla nitoke?
One, please get an annual physical done. And that one is targeted.
Nimesikia.
Just double click on that.
Hiya guys, next episode nitakuwa na appointment. Let me
Okay.
just say it.
And I'll keep her accountable because she. Two, health is also dental health. Please also go
Yes.
go to your dentist. It's also your eye health, right? It's also your mental health. So if you're struggling, please reach out to someone. Please, therapy is also being offered free in Kenya. There are services in Kenya that are free.
Okay.
There are also services here in America that is free. Always Google and you can find. And yeah, educate. I feel like educate yourself and be an advocate for yourself is what I want to be a parting shot for everyone. You know,
Right.
stand firm. If you're not feeling good, you're not feeling good.
Yeah.
You know,
And don't ignore it.
don't ignore it. Don't. Black people are we are bad because we get diagnosed later on disease, and that's why there's that fear that nikiingia hospitali sitaitoka. You know, because we don't go, right? We want to go when it's done and then.
It's at the end.
Yeah.
Hey.
Jerry, I have a very random thought that just came on my head. I'm just remembering the story you told us on a different episode about how you you went to the pharmacy.
What did I do? I went to the pharmacy.
Is this the cousin doctor who sent you out?
Did I send you?
No. It was my friend, Dr.
It was your
Laura.
friend. Okay.
Yes.
Oh no, I thought it was her. No, this girl went to a pharmacy and she said, I want this medicine. And they told her you need a prescription. But she showed them the WhatsApp message.
My friend is a doctor. She's the one who said, do you need to talk to her? So it's a Laura kwa wapi Kenya. I'm at CVS.
Wow.
No, because they asked me, where's your prescription? You need it from my doctor. I said, no problem.
But it needs to be an e-script or a paper script. Not on
They did
WhatsApp.
not say all that. They said,
Kenya, that will work. That will not work in the streets of America.
I'm sorry, I still remember that.
Where?
I wish a WhatsApp message. It's on WhatsApp.
This is a script in itself.
yes.
Oh, wow.
Do you need to? Because we were chatting live. When I told her my symptoms, she said, go to CVS, ask for this. Because, you know.
Oh, it wasn't over the counter. It wasn't an over-the-counter medication.
No. It was uko nyuma at the pharmacy.
Was it an antibiotic?
I don't know what it was. It says ikumbuka. But the thing is, they said it needs a doctor's prescription. I said, no problem. Here it is. They asked me, what is this? I said, it is WhatsApp. It's an app we use to communicate.
It's not even an iMessage. It's
WhatsApp.
It's WhatsApp.
Hey, Kamkunji dispensary.
Anyway, sawa. We live and we learn, guys. If you haven't done the things, sijui mnangoja nini. We have learned so much today from Dr. Wangechi. Asante sana.
Anytime.
For coming and shouting at us.
Tagging us.
Goodness.
Huh?
Ni kama tumekuwa offend.
Kidogo tu that ukufanya annual. Kidogo tu.
I didn't knew again. But we're working on being healthier this year, on getting our annuals done. I think for our fellow Maju mates and anyone watching, kwa description we'll put the main things we've talked about so that you can refer back to it and schedule those appointments because they are free apparently. So tutaona.
Yep.
Haya, tumemaliza.
Anyway, you guys, thank you so much, Dr. Wangechi, for spending some time with us today and for imparting us with so much knowledge. And I hope you guys have learned something and you will do better. But please do interact with us on our social media handles. Please follow us. Let's keep it going. You
email.
Yes, an email. Let's keep it going. We shall celebrate together when we get that Google AdSense. We will celebrate together. But yeah, thank you so much and we'll see you guys on the next episode. Bye.
Bye.